5 on your health tonight. So earlier this week, we told you about new data that shows more than a third of children in the U.S. are taking at least one dietary supplement. Here to talk about that, answer some questions, is Dr. Rick Malley from Boston Children's Hospital. Good to see you, doctor.
Hey, Dr. Malley. Thanks for your time. So let's start with the basics, right? You've got prescription drugs, you've got over-the-counter drugs, and then you have dietary supplements. So what should parents know about the difference?
Well, the most important thing is that it's important to note that these dietary supplements are not at all supervised and controlled and regulated to the same extent as either over-the-counter drugs or prescription drugs. And so this means that you don't always really know what is in these supplements. And we cannot really guarantee that they contain exactly what they say, that they don't have any contaminants. And also there can be no real claims of efficacy because they basically are not in the purview of the FDA to determine whether these supplements have any real benefit.
Doctor, you're the expert. What do you consider when I say children?
Well, I guess since my kids are past college and they still often come home, I think that definition is extending, if you will.
Okay,
but I think
all right.
Yeah.
So you're talking. I think it's important to get that context when we're talking about that, because most people refer to dietary supplements as vitamins, not drugs. But in your opinion, they're still drugs?
Well, in my opinion, in a way, they're more risky than drugs because there's not as much control over what's in them. And I think the most important message for your viewers is that nobody should be taking dietary supplements without consultation with a healthcare practitioner to make sure, first of all, that they're taking something that might have benefit, and secondly, that they're not taking too much, which has been reported in the past with serious consequences.
That's interesting. You got my attention with that, doctor. So some dietary supplements are marketed as immunity boosters for kids. So what's your advice about those and taking them?
This came, of course, during the worst time of the COVID pandemic, where people were trying to improve their immunity in any way that they could imagine. But there really is no hard evidence that taking these supplements will really help. There's some small evidence in the developing world about zinc, for example, improving the health of children. But that, of course, is in the context of children who, by and large, don't have a great nutritional profile. And so in the US, for example, where still the average nutritional availability of good, healthy foods is greater, where parents could, of course, rely on their healthcare practitioners to understand whether their children are going through a good diet. In most cases, I think the addition of supplements to improve immunity is really, first of all, unproven, and secondly, not necessary.
Oh, great advice.
Interesting. All right, Dr. Malley, thank you so much for joining us. We appreciate it.
Thanks.
Stay well.
Thanks, Dr. Malley. Great to see you.